And let's get to some health news on this midday. Severe cases of a strep infection in children are being reported throughout the country, including right here in Texas. Deaths are also being reported. Well, our medical expert, Dr. David Winter from Baylor Scott and White Health joins me. And Dr. Winter, we have obviously heard that strep throat is going around the country, but it sounds like this is an entirely different infection. Can you kind of break down what we're seeing here?
Yeah, strep infections are caused by the streptococcal bacteria, and they present themselves in two totally different ways. Strep throat, relatively mild, common in children and adults, usually easy to treat. Invasive streptococcal infections, whole different story. Fortunately, they're rare, typically occur in children aged 5 to 15, though we have seen a fourfold increase this year, even deaths, 60 deaths in Texas children right now. So same bugs, same bacteria, totally different manifestations.
And how can parents tell the difference between that common strep throat virus and this more serious infection?
Yeah, a strep throat is bright red, tender. You may see white pus pockets on the back. No other symptoms typically, no cough, no fever, no shortness of breath. Invasive symptoms, now those are different depending on where they attack. Can be in the skin, the heart, the lungs, the kidneys. Can affect the circulation system to drop your blood pressure significantly. Those things are much more serious and need very quick medical attention.
And I feel like over the last 3 years, we've kind of had this crash course in how to protect ourselves from viruses. But how are strep infections spread? And how can children be protected from getting them?
Yeah, Megan, it's spread just like the respiratory viruses, typically through the air or close contact. So coughing, sneezing, that can spread it. Sharing cups, sharing spoons, that can spread it. Hugging, kissing. You want to teach your kids to stay away from folks that are sick and also frequent hand washing. All those things can help prevent the spread of this and other infections.
And so how do you treat a strep infection if you do get it?
Yeah, strep throat is pretty easy to treat. Amoxicillin is a favorite drug, although right now it's in short supply in this country. But a penicillin shot or other oral antibiotics will work. Now, invasive streptococcal infections, those require typically IV antibiotics, often blood pressure support, typically in the ICU, so much more intensive treatment with those conditions.
And when would parents know to actually seek that medical attention for that potential strep infection that may be serious? When do you know?
Yeah, I first want to emphasize the importance of a relationship with a parent, child, and a pediatrician. With diseases like this, you want to get some quick answers. But anything more than just a mild sore throat, any significant sore throat that has fever, any rash, particularly if it's blisters and peeling skin, weakness, fever chills, lightheadedness, confusion, with any of those, call your pediatrician or go to the emergency department. Very serious illness here.
Absolutely. Dr. Winter, thank you so much. Appreciate your time on this Friday.